love sunmer. Fun activities outside in the sun and getting that nice golden tan is amazing. However, it can be one of the most dangerous things for our skin. A simple mole on our body can mean the worst, skin cancer. Melanoma can develop very rapidly over several years, so being aware about what it is can be very beneficial. First, we will evaluate melanoma and its causes. Second, we will discover symptoms of melanoma skin cancer. And finally, we will learn tips on how to prevent melanoma and the treatment options. First, let's evaluate melanoma skin cancer causes. The exact cause is not clear, but there is research behind what happens to the skin. The skin cancer starts in the melanocytes. According to Mayo Clinic staff who wrote Melanoma Causes in 2023, a professional journal, melanocytes are the cells that make pigment that gives skin its color. This pigment is known as melanin. Something changes the healthy melanocytes into cancer cells by changing their DNA. The DNA has different instructions, which is to make more cancer cells as quickly as possible. Cancer cells can keep living when the healthy cells die. Many professionals at Mayo Clinic believe that ultraviolet light is the leading cause. This includes direct sunlight, tanning beds, and lamps. Not all places on a person's body is exposed to sun, so this means that there could be another factor, such as environmental factors or genetics. Betty G. Jackson wrote a book on October 24, 2022 called Melanoma, A Guide to Understanding and Managing Cancer of the Skin. She revealed that differences in skin types could affect your chances of getting skin cancer. As you can see here, people who burn easily and are more prone to frequent burning are more likely to develop melanoma because there is less melanin in their skin to protect the DNA from getting damaged. However, people who are usually more tan and don't burn as much are less likely to develop melanoma because there is more melanin that can protect their DNA. Now that I've evaluated melanoma skin cancer causes, we will discover symptoms of melanoma. Everyone's symptoms are different, so being aware of all the different types can be very beneficial. To detect subtle symptoms in the first stages of melanoma, you can ask yourself the ABCDE acronym. Dr. Patrick Wu, President and CEO of Moffitt Cancer Center, wrote Melanoma Signs and Symptoms on June 16, 2022. First, you can look at asymmetry. Does the mole have two parts that look very different? Border does the mole have an irregular or blurred border? Color. Does the mole have different colors, such as tan, brown, and black? Diameter. Is the mole larger than 6 millimeters or about the size of a pencil eraser? And finally, evolution. Has the mole changed in size, shape, or color? Some melanomas do not look exactly like the ABCDE acronym. Some may consist of a black streak underneath the toenail or fingernail, a small scaly patch, abnormal tissue under the skin, or a bump, sore, or rash that doesn't heal. Late-stage melanoma can consist of more uncomfortable symptoms in the skin, such as itching, bleeding, oozing or crusting, or painful and irritated skin. If melanoma is not caught in an early stage, it is very likely that the melanoma will be spread to other parts of the body, causing many serious complications. For example, your lymph nodes may become very swollen and there will be hardened bumps underneath the skin. For your brain, you might experience headaches or even seizures. And finally, you may feel an extreme sense of fatigue, weakness, or numbness in the arms or legs. Now that we have discovered the symptoms of melanoma, we will finally learn tips to prevent melanoma and the treatment options. Mayo Staff Clinic, who was previously mentioned, wrote in their Causes of Melanoma about prevention tips of melanoma. There are many ways to prevent this cancer. First, you can avoid tanning lamps and beds, avoid sun during the middle of the day, wear protective clothing, and finally, wear sunscreen with an SPF of at least 30, reapplying at least every 2 hours. If melanoma has already developed, there are several treatment options. First, freezing. The doctor may destroy early skin cancers by freezing them with liquid nitrogen. Excisional surgery is where the doctor cuts out the cancerous tissue and its surrounding margin of the healthy skin. Radiation therapy uses high-powered energy beams such as X-rays to kill cancer cells. In chemotherapy, drugs are used to kill the cancer cells. And finally, photodynamic therapy is where the treatment destroys skin cancer cells with a combination of laser light and drugs that make cancer cells sensitive to the light. The Food and Drug Administration approved a new cancer therapy that could one day transform the way aggressive tumors are treated. Erica Edwards, health and medical news writer for NBC News, wrote a periodical on February 16, 2024, named FDA Approves Groundbreaking Treatment for the Advanced Melanoma. This treatment is called Amtagvi, also known as TIL therapy. It is for melanoma patients who have already tried and failed other drugs or cancer treatments. This is the first treatment for cancer cells that use immune cells to fight off cancerous cells that have spread to several parts of the body. As you can see, there are many treatment options for if you ever did develop melanoma. First, we evaluated melanoma skin cancer causes. Second, we discovered symptoms of melanoma skin cancer. And finally, we learned tips on how to prevent melanoma and the treatment options. Melanoma is a common type of skin cancer and is very, very dangerous for our skin, so everyone should be aware of it. Now you can stay safe in the sun and protect your skin while still having fun outside in the summer. Thank you.